Does a delay for cancer treatment of 4 weeks impact your lifespan? Hi there, my name is Dr. Walter Lembo, naturopathic physician with a practice solely focused in cancer care for over 20 years. There's a paper that was published back in 2020 during the beginning of the pandemic. It was actually published in the British Medical Journal. The authors were Canadian and from the UK, and they were looking at some more common solid mass tumor cancers. So involve like breast cancer, rectal cancer, colorectal cancer, cervical cancer, bladder cancer, head and neck cancer, and obviously wasn't all of them. And they were looking at time from diagnosis, and these were people that were curative in nature, so it's non-palliative or advanced, and by the time of diagnosis to treatment. And they were looking at 34 studies, 17 cancer treatment indications. So this was like a review, it was retrospective. They were looking at just under 1.3 million people treated. And they noticed that a delay of receiving treatment from 4 weeks actually could worsen your lifespan. And so this is just the criteria. So treatment delay was defined as, and I'm reading this, time from diagnosis to treatment for the first treatment, so like say surgery, radiation, time of surgery to treatment to receiving adjuvant indications. So you've had surgery and you're doing like adjuvant treatment, so chemotherapy, radiation to say mop things up. And also they looked at from time of neoadjuvant treatment, so when you're given, say, chemotherapy first to shrink things down. And then delay was defined from the time of diagnosis to the start of this neoadjuvant treatment. And also, though, looking at from the end of receiving this neoadjuvant treatment, so say chemo first to shrink things down to the time of surgery. So they really did their best in looking at some complexities, and so and here we are in a socialized model in Canada where there has been delays. I know the system is working hard to improve that, but imagine as well, like, so say when people are given adjuvant, say chemotherapy, sometimes the values is a few percentage points, but every point adds up. So in essence, if there's a delay in receiving treatment, that could, in essence, like negate the potential gains of adding on that adjuvant treatment. And again, it wasn't looking at all other cancers. I didn't see mention of, say, ovarian cancers. You don't see pancreatic cancer, gallbladder cancers. You're not seeing any of those. And they were just looking at some of these bulk ones where they can collect data on. But imagine a simple, and they also noticed that even at 2 weeks, there was some signals there of impacting the survival as well, to a lesser extent. And so while there's been some other studies looking at, say, breast cancers and saying, well, maybe delays aren't as bad, maybe in smaller subgroups, nonetheless, and that was retrospective in nature as well, this really kind of, should have gotten a lot more attention, that just by simply delaying treatment by 4 weeks could start impacting potentially your lifespan, your survival. So obviously more information to come, but this information, should be strongly looked at. I know there could be other reasons why there are delays in treatments. There could be complexities. They could have complications. But the system needs to be working really hard to provide timely accessed care and treatment until information is proven otherwise.